I'm Dr. Jim Drackley, University of Illinois.
And I'm Phil Cardoso, an associate professor at the University of Illinois. And we just have a link to provide on a paper, on a symposium review that we have on nutrition strategies for improved health, production, and fertility during the transition period at the Journal of Dairy Science. A common question when we suggest, for example, hey, your prepartum diet, if you're doing one dry TMR, that's fine. Or if you're doing a close-up pre-fresh 30 days before, that's fine too. We recommend 1,200 grams or 1,300 grams of metabolizable protein on that diet.
Yeah.
And then people get caught up on, okay, but with what intake you're telling me, right?
Right.
You're telling me that my cows need to have 16 kilos per day, or they have to have 10 kilos per day or 14 kilos per day. And I think the point is making sure they're getting the nutrients, right? Because the intake is going to be impacted by so many things that any requirement, it's going to be difficult to have access on. Do you have overcrowding on your pen? Yeah. Do you have facilities where heat stress really dump cows' intake? Do you have your heifers or first lactation together with more mature cows, or some competition may happen, right? So I think that, that's a good concept, that you need to have the nutrients in the amount of intake that you usually can have, right? Yeah. So some people get bumped up on, my whole life that I get 12 kilos of intake, right? The magic is how can you fit that? But I think if cows, they allow for perhaps more intake because of comfort, because of other things, that may allow then for the diet to be perhaps less dense, and that allows for perhaps a cheaper diet.
Right.
So if I'm using a bypass soybean meal type of product, or if I'm using blood meal, and now I can use that because I have certain amount of intake and that fulfill my requirement. But if I don't have that, I may have to go to a really more maybe bioavailable, more expensive source. Right. So cows can eat less with more. Does that make sense to you? Or?
Yeah, it does. And I agree that it's another area that people get caught up on. And it can be tricky to fit all those things in, because as you say, it is the amount per day that's needed. And sometimes we're kind of going in different directions with these different things. So getting the whole package is not necessarily easy. I think people get hung up on how many grams of metabolizable protein we need. We don't really know that number very well. I think the new CNCPS numbers are 1,300 grams a day or more, and that's quite a bit. But if people have 1,280 on their calculated formula, that's probably close enough. Mm-hmm. And I think people get too worried about the absolute number rather than trying to make sure that we're in the correct area with all those things.
And I think one of the things that intake really maybe bring a little bit more on the confusion when people say, hey, you need to have at least this much. And I remember talking about, like a light for when you're on the streets, like red is trouble, you're in trouble, yellow, that's okay, green, it's okay. But that's, that can have a big variation for what is the average on your farm. But whenever we are adding a DCAD diet, that's a big concern, because especially, I think from the past on ammonium sulfate and other raw materials were being used, you could have more effect on that intake being reduced because of those products. And then people really got kind of, I don't know, but kind of afraid of the technique. Yeah. And now in that, with Jeffy Goff and a lot of other research that got much more explained, right? Even the formula, and try to identify what are the minerals that are more acidifying than others. we talk about that technique, and I know that you have a paper coming out about it as well.
Yeah, we do. Should be out in the next 3 or 4 months, I think. But that's kind of looking at acidification versus the low calcium diet approach, and we showed pretty positive effects of the acidification in a controlled energy diet, which is something that nobody's really looked at before. So it really opened my eyes. I guess we'd been working with the partial acidification idea for many years with the controlled energy diets. And it seemed to, it was effective in preventing milk fevers, but we didn't really, we weren't really considering subclinical hypocalcemia. And I think that as we've looked in a couple of experiments, we had a lot more subclinical hypocalcemia, and that was causing lower dry matter intakes after calving, and probably a higher incidence of some other health issues than we would like to see. So I think the acidification is still, we have to look at that as the gold standard for how to manage calcium. And people want to take the easier way out and not have to measure urine pHs every week, and that's understandable. But when it's the best technique, sometimes you just have to accept that that's part of the management necessary.
Transition cow trial that we did with rumen protected amino acids, we, as a management practice, we use acidification, and we were measuring urine pH, and we kind of, tested 2 different strips against the pH meter, right? And the correlation is amazing. It's fairly easy, and with very good confidence, farmers, they can use those urine strips to measure the urine pH, and it's not very, but what I say is not very easy to make sure things you are adding in a diet are working or not, so directly. But so that's kind of a one strategy that you can really check, right? One thing at that trial, I remember you had, a DCAD or acidification with or without calcium, right? And that calcium was at barely 2% of the dry matter intake. So one could think about, well, 2% it's a lot of space within a TMR, right? But at that trial, proof of concept, right? Just trying to understand how calcium is playing that role. Calcium carbonate was used, right?
Correct.
So do you get that question kind of why 2% or why calcium carbonate?
I've had both of those questions. I think the amount is so the recommendation that the company that we were working with was using was 180 grams per day, and so we wanted to make sure we were not shorting that, and actually bumped it up to the 2%, as you say, and we had intakes of over 200 grams per day, up to about 220 grams per day, I think. And so one thing we showed there was that it wasn't really negative for intake. In fact, it was better than the acidified diet without calcium added.
Is there space for a different source of calcium, so you can perhaps have more space for other things in the diet?
Yeah, I think that's a good point. And I know Tom Overton at Cornell has just looked at that in a recent experiment. I don't remember the details, but I think the source of calcium is an interesting question, both if it continues to be shown that it's an important part of the acidification strategy, but also from economics and other reasons as well. So I think that's an area that's just beginning to have some research attention.
And we discuss in this paper here, the Symposium review, is that most of the time we try to put together data, and we do have available the meal equivalents, or we have how negative those diets are, and we try to make correlations with that information and how cows performed. However, there are not a lot of research out there that with the diet negativity or milliequivalent is providing as well urine pH. So it's fairly common that you can find two diets with the same number for DCAD. Both diets can be -15, and one can be at one certain urine pH and the other one cannot be as effective and with a higher urine pH, just based on other things that impact the cows eating or not that whole diet, right?
Very true. So we had to go very negative on the calculated DCAD or the DCAD determined on chemical composition that we had. We were down -24 to get the urine pH in the range of 5.75 to 6, where we wanted it. And I know that, you know, in other experiments, you often would not see anywhere close to that low, but we were titrating it based on the cow's response, and that's where we had to go to.
So do you think that if you targeted -6 or -6.5, you would decrease the amount of impact you saw on the health of those cows?
You know, I think one of the problems if you don't acidify aggressively is then you have a greater number of cows that are going to be up in the range where you're not getting them effectively acidified. So, you know, you have your normal variation of cow responses, and you get the high end of the cows then on urine pH is going to be in the range where maybe it's not as effective. So that's one reason I think that, you know, if you're going to do it aggressively and do it so that you know you're doing it correctly. And I think the target that we had surely seemed to work very well with our cows.
And we had a chance in another paper to look into a little bit more on the reproductive side of things, and
yeah, very interesting.
Yeah, uterine recovery and follicular dynamics were happening on those cows from your experiment, and that was very interesting. Where, you know, our trial was not designed for that. We didn't have enough cows for pregnancy evaluations, but when we ran stats for that, right, on the odds ratio or even survival analysis, but again, we are not with that power. The same thing when we are not really with the power to report any diseases, but we have to do anyway, right?
Right.
Because everybody asks about it. So on this side, and seems like, you know, the cows that had the DCAD, negative DCAD plus the calcium, they got pregnant, or they tended to get pregnant before the other two treatments. And we were able to do uterine biopsies, and we really saw that the endometrium was really different. And it kind of makes sense, right? Because if you think about calcium metabolism and how is that involved in cell regeneration and recovery and muscle contraction and everything, that
right,
it kind of makes a lot of sense. And and I think it helps also with the inflammatory response on cows and being able to recover a little bit faster than whenever the cows have a negative DCAD without calcium, or the control that was just a normal positive or fairly just a little bit positive DCAD before calving. And that's kind of not, maybe it's not a surprise, but you know, is it better? It is better not to do the DCAD or than to do the DCAD without the calcium. And it kind of was very interesting how those cows had a little bit more score for vaginal score that could, you know, like some kind of purulent vaginal discharge, how we say, PVD. So it doesn't seem to be a good idea to do a negative DCAD diet and you don't bump the calcium up, right?
It was interesting that in our study there, that the repro side, the things that you measured related to reproductive function, was actually the most clearly affected by calcium. We had, you know, the mean milk production was higher for the diet with the extra calcium, but it wasn't significant. Again, just not enough cows. So there was really very few things that were that were significantly affected by the calcium in the production part of the experiment, but you clearly showed the effect of the additional calcium on the aspects related to reproduction. So I think that's an important point. I think as we go forward with science, is we got to be looking kind of at some point we have to be bringing all these aspects into the equation, because we may be missing part of the story about how the cows are responding, or how they're partitioning nutrients towards towards the immune system, or towards reproductive recovery, or not. So I think it's an interesting example of trying to look at the whole picture.
And I think you measured calcium excreted in urine, didn't you?
Yeah, we did, yeah.
And that goes up pretty high as soon as you start doing the negative DCAD, right?
It does, and it went up even higher with the additional calcium. So that's kind of the concept, is that you increase the flux of calcium going through the system. Doesn't change the concentrations necessarily, but there's just more moving through the cow all the time, and that's helping prepare then for the changes that are necessary at calving, where that increased flux, now it's the kidney shuts off that urinary excretion, and now that extra calcium is available to counteract the immediate drop in calcium from calving and the start of milk production.
Yeah, that was very interesting. And you also had, I think, one very cool stuff was you were able to measure calcium, not just total calcium in plasma, but also you measured ionized calcium, right?
Correct.
And
yep.
fairly early after calving or around calving, what's kind of sometimes is a little bit hard to see, right?
Yeah, so we looked at calcium as soon as possible after calving, and then we looked at it 1 day and 2 days and 4 days. And some of the research that's come out recently from the group at Cornell is looking at the rate of recovery of calcium being more important than that drop on the day of calving. So we found that the ionized calcium on day 1 was a pretty good indicator of what was happening. And then the total calcium on day 2 was also was a pertinent indicator of how the cows were responding. So having both ionized calcium, which is what's actually active in the cow, and the total calcium, I think helps tell the complete story. And they're not extremely well correlated in that time right around calving. And so you can't just say that ionized is a certain percentage of total calcium, because it's not true to that as things are changing around the time of calving. So having both of them is very helpful in looking at hypocalcemia. Are they able to reestablish homeostasis with calcium? And it seems from some of their work that cows that are not able to do that by 2 days after calving are the ones that go on to have problems.